Hi and greetings to everyone. My name is Ko Jun Wei and my metric number is BM24110041. Today I would like to share about my ambitions and specialists that I wanted to be in the future, and also I would like to introduce psychiatry field to you guys. So before we start, we have to know that psychiatry field is always interrelatable with neurology, because anything that regards to mental and also emotions is mostly because of neurons, right? So we start with part 1, physiology. We have neurotransmitter system and brain structure involved in physiology. So for neurotransmitter, we've got dopamine and also serotonin. And dopamine is neurotransmitter that helps stimulate in reward, pleasure, and motivated. Is commonly known as neurotransmitter for good feeling. Okay, and then serotonin is help in happiness and lowering down the level of depressions, commonly known as a mood stabilizer. Okay, and then dopamine can involve in dysregulation linked to schizophrenia, and serotonin will help involve in mood regulation. For brain structure, we've got prefrontal cortex and also hippocampus involved in it. So prefrontal cortex is the front part of the frontal lobe of the cerebral cortex. Is here, prefrontal cortex, and hippocampus is a curve-shaped structure in temporal lobe. It's somewhere here, but it's actually beneath the surface structure. It's not at the surface, so it's barely can be seen. Okay, so the function of prefrontal cortex is help in social behavior and emotion regulation. So dysfunction of prefrontal cortex may lead to depression, and then hippocampus is help in memory and learning. It helps in converting short-term memory to long-term memory. So dysfunction in hippocampus may cause Alzheimer's disease. Okay, so moving on to the second part, surface anatomy of psychiatry. We have quite 3 regions found in, which is frontal region, temporal region, and occipital region. So for testing of the reflex and for the mental brain works, we have few tests which is called glabellar reflex and Georgia reflex. Okay, glabellar reflex is to evaluate blink response when area between eyebrows is tapped. Okay, it's called glabellar. And then Georgia reflex is a stretch reflex used to test the status of a patient's trigeminal nerve. Trigeminal nerve is a nerve that sends signals from the face to the brain. Okay, so this is a glabella and this is a Georgic. Okay, so for glabellar reflex, if it's a normal person, when you tap the area between eyebrows, a person will actually blink. His or her eyes will actually blink once or twice, and but then after several taps, the eyes will not give the response already. Okay, so if you keep tapping and that person's eyes keep blinking after several taps, okay, so this will cause, this is called a dysfunction lah. Okay, a disorder, I mean, it's abnormal reaction and commonly will known as Meyerson's sign. Okay, this is Meyerson's sign will occur because of neurological dysfunction. Okay, particularly in basal ganglia. Alright, basal ganglia is very important in regulating the movement and also the reflexes. Okay, so now we move on to Georgia reflex. Georgia reflex is a brief contraction of masseter that is will cause the jaw to close momentarily. So if the jaw closes widely and strongly in response to your tap, then this will be considered as a hyperactive, okay, response. Hyperactive response is because dysfunction of upper motor neurons, or as known as brainstem, uh, upper motor neuron or brainstem, okay, not as known as. Okay, so the third part is autonomic nervous system. We have two autonomic nervous system, which is called the cervical ganglia and the vagus nerve. Cervical ganglia is here, this one. It starts from the C1 to C8 to T1, and vagus nerve is the color part. Okay, so cervical ganglia involved in sympathetic response, and then vagus nerve involved in parasympathetic response. Okay, so we know that sympathetic is stress, anxiety, and danger situations, and vagus is calm and relaxed situations. Okay, so emotion regulation and mood. All right. For response type, in sympathetic we have fight or flight. That is well known already. That your heartbeat will increase, and then your pupil size will dilate. Okay, and then parasympathetic is rest and digest response, where your heart rate will decrease and then pupil size constricts. Okay, sympathetic response trigger is because of the neurotransmitter norepinephrine, whereas parasympathetic is because of the neurotransmitter acetylcholine. Okay, yeah, this is stress, this is relax, that's all. So moving on to the type of treatment. For psychiatry, we have two types of treatment, okay, that might occur at the same time, which is physically and mentally, that we known as psychotherapy and medications. Psychotherapy, often known as thought therapy, and then it aims to improve the mental health by underlying mental issues. Medication is pharmaceutical drug prescribed to help manage and also treat mental health disorders. So some examples of psychotherapy is cognitive behavioral therapy, psychodynamic therapy, humanistic therapy, family and couples therapy. For medications, we have some drugs prescribed, which is called antidepressants, antipsychotics, mood stabilizers, anxiolytics and sedatives, and also hypnotics. And these are the examples of those drugs prescribed. Alright, then moving on to the part 4, disease and treatment. Here are some disease and the following treatments of psychiatric field. First one is depressions, well known, everybody seems to have it. They have symptoms like persistent sadness, loss of interest, fatigue, feelings of worthlessness, and also some. Okay, so treatment for it actually will suggest to take antidepressants for medications, and also cognitive behavioral therapy for this psychotherapy. Okay, now we have a second disease. It's called anxiety disorder, where the symptoms is excessive worry, restlessness, tension, and panic attacks. Okay, so the following treatments we suggest will be buspirone for chronic anxiety, and also benzodiazepines. For uh, schizophrenia, we have some symptoms of hallucination, delusions, social withdrawal. And then the following treatments suggested will be antipsychotics and cognitive behavioral therapy for psychosis. Okay, and then last will be post-traumatic stress disorder. whereas the symptoms of flashbacks, nightmares, emotional numbness, and following trauma. And then the treatment suggested is prazosin, trauma-focused CBT. CBT, CBT is this one, cognitive behavioral therapy. Okay, I think that will be the disease and treatment for me. And then now I would like to introduce the psychiatrist, Dr. Tan Chi Kwan. This one. Okay, he this doctor is very dedicated and focused on treating and improving mental well-being for a wide range of individuals, particularly in the area of psychiatric care in Malaysia. Okay, this is Malaysia doctors, and he also raised funds and donated to Penang Home for the infirm in age, showing his commitment to social welfare. And he also came out with a book called My Life as a Psychiatrist and Galleries. Okay, the reason that I introduced this doctor, Dato, is because um, he is a psychiatrist, but he not just contribute himself in medicine field, but also in other field lah, like galleries, arts, and he not just treat patients that comes to him, but also indirectly treat everyone in the society by publishing the book, by raising the funds. He aims to build a healthy mental for every individuals in the world, regardless to age. You see, um, and also gentle, and not just to patients that thinks they have sickness but or disorders, but also healthy humans like us, healthy individuals like us, to help to improve our mental health, tell us the ways to get stronger. Alright, I think that's all for my sharing today. Thank you very much for your hearing, and I am Jose once again, and thank you. Hope to see you soon.